So I can see I've accepted our main speaker to join, Professor John Osai Kwapon. So I would go straight to introduction because we have very little time today. So Professor Osai Kwapon has over 15 years experience in higher educational management, including research, planning, and institutional effectiveness. He has taught courses such as research methods, political economy, comparative politics, international relations, and public administration. He's a fellow with the Ghana Center for Democratic Development, where his previous work has focused on politics of development and governance. Professor John Osai Kwapon holds a PhD in political science from George Mason University, a master's in public administration from Clark Atlanta University, and a Bachelor of Arts in political science from Hilton University. He was recently appointed Associate Provost for Assessment, Accreditation, and Institutional Effectiveness at Baruch College, the City University of New York. Prof, we are very honored to have you to present to us today.
Thank you, Derek.
Maybe I should allow to share screen.
Yes, please.
Let me see, who do I allow to share? Where do I do that? Prof. Okay, Prof is here. Should I make it to share? Okay, let me make you a host. Share screen. Okay, let me make you a host so you can share the screen from your end.
Sure.
Okay. So as usual, you have about 25 to 30 minutes of presentation.
Sure.
And then 20 minutes of questions because Prof will have to leave us at 3 o'clock.
Okay, sounds good.
Yeah. So Prof, if you're ready, you can.
Yes, I am.
Over.
All right, so greetings once again to everyone, and thank you for the opportunity to share findings from my current research that looks at what happened during the COVID-19 school closures and its impact on Ghanaian households. I would also be very grateful to get your feedback, your comments, because this is actually a pilot study that I'm looking to expand as the study goes along. So I would definitely appreciate any feedback, any comments, any questions, any things that I can do to even strengthen the study. So here's the context for the study. So again, if you think about education and the COVID-19 crisis, generally educational institutions have had relative stability, no major interruptions over the last several years, even in places where, as a result of interruptions due to tragic human events, natural disasters, teaching and learning have generally have gone on after a few days, or at least they've managed to find ways to cope and go on. I think the unfortunate thing with this stability is that what happened to educational institutions is we made no investment in putting plans in place to deal with the sort of large-scale, long-lasting, enduring disruptions to teaching and learning that we have seen in COVID-19. Then COVID-19 hit, and with all the health implications and the need to close down educational institutions, it forced us to transition quickly into how do we come up with plans that allows us then to actually transition to teaching and learning using non-traditional methods. If you think about the case of Ghana, March 16, 2020, all schools were directed to close The policy was modified sometime in April, which only allowed for specific students to return. So it was final year students in GHS to come and write their exams. Same thing with your SHS students. But you can also think of our context as we had no existing plans that ensured continuity of teaching and learning in emergencies, no response plan. Quickly, the Ministry of Education came up with what they call the COVID-19 response plan. In that COVID-19 response plan, MOE detailed strategies on how they were going to use three main platforms to ensure that learning continued even as schools were closed down: radio, television, and then they had the learning management.
Hi, Prof. John.
Yes.
Because you are the host, there are a few people that you would have to let in. My apologies.
Okay, I'm sorry, no problem. Let me do that.
Yeah, so you can just admit on and then you can then continue.
Sure, all right, I've done that. So again, as I mentioned, there were three key remote learning platforms that the Ministry of Education in its response plan was going to use: radio, television, and then a learning management system as well. The schools will remain closed for a total of 9 months, and then they would reopen sometime in January 2021. All right. So if you think about the entire educational landscape and what all of this meant, we are talking about if you think of government policy at the center of these closures and how wide the tentacles spread, you're talking, everywhere from creche all the way to tertiary institutions. At my last count, so if you look at the big picture, we were talking, and this is even numbers from the 2019-20 academic year, but we were talking about a total of about 33,000 schools with about 10.5 million learners that we had to move into a remote teaching and learning setting. So this is what the pilot study was trying to do. The key question driving the study was, how did the policy decision to close schools as a result of COVID-19 impact households? And then the key thing that I was looking at is then, in order to look at the transition and understand what happened to households, there were a number of things that the study was interested in to describe and document the barriers that were faced, how those barriers affected online households' participation, how what sort of strategies then households had to adopt in order to be able to cope during online and remote learning, what the transition to remote learning, the sort of impact that it had on households, and then to begin to see what kind of early signals we can begin to capture from the experiences of households, any lessons learned, and particularly the policy implications of the choices made to deal with the COVID-19 disruption. So this is the conceptual framework for the study. So if you think about the educational landscape pre-pandemic, characterized by stability, traditional face-to-face teaching and learning, and then you have this triggering event, COVID-19. You can think of some of its characteristics as it was unanticipated, very disruptive. Nobody even knew the duration of the disruption, very global in nature. And the key thing here was that it demanded rapid policy responses from all sectors in any given country. We had to sort of think on our feet and keep coming up with ways to deal with the ever-changing nature of this virus and how it was impacting everyday life. So the policy response in education was school closures, remote learning, psychosocial support to deal with the non-academic side of this virus, and a public education campaign so that folks could know the measures they could take, for example, to stay healthy. Then you have the transition then to the pandemic phase where we've transitioned to remote learning. And the three key dimensions of that transitional experience that the pilot was interested in beginning to explore was the barriers, the coping mechanisms, and then the impact. So this is based on the experiences of parents and guardians in a semi-urban town in the Middle Belt area of Ghana, about 17,000 residents. And again, I used the survey to capture the experience, a representative sample of parents and guardians, questions in 5 categories. So their demographics, barriers, participation, coping mechanisms, and then the impact of remote learning. Surveys were conducted in English or in the local dialect of the respondents. Overall, we were able to get about 500 households to respond to the survey. And the data collection was between May 3rd and May 8th. All right, so the key study concepts. So again, for demographics, it was gender, composition of the children in the house, whether it was a single gender or it was mixed type of school the children attended. Then I introduced a variable called the school bedding. And that was very critical because in all of the transitions, and if you're looking at a lot of the studies, no one has yet explored what I call the school bedding, meaning that was it more challenging to transition to teaching and learning remotely for households if they had maybe, even if they had 3 or 4 children, if all of them were in primary, or if all of them were in JHS, or if all of them were in SHS, what was the transition like versus if the household had a higher school bedding where 4 children and they were spread across the entire educational landscape. In terms of the barriers, I looked at the technical barriers. So does the household have a radio, TV, computer, internet access? The awareness barriers was, were these households even aware that Ministry of Education had put out a plan that said we would use radio, TV, and a learning management system to ensure that learning continued? And the other barrier I looked at was availability, right? So even if you had the technical instruments to do remote learning, were you aware? And even if you were aware that these avenues were there, how available were these opportunities anyway? Then the participation dimension looked at to what extent that households and their children participate in learning through radio or TV or the learning management system. In coping mechanisms, I looked at the parents and guardians take on the role of teachers at home, or did they ask other family members to step in? Did they use private tutors? Or did they go out to buy some learning materials for their children to use at home? In terms of the impact, I looked at teaching and learning. So how did households feel about the loss of learning during this 9-10 months that the children were at home? How did they feel prepared? The cost of learning materials, and then the social impact as well, loss of interest in school, their children getting into any kind of trouble, any emerging social issues, particularly for the girl child, because again, if you look at the literature, some of the concerns were about the social implications for the girl child when we had to transition to remote teaching and learning. The data was handled this way. So I ran a number of descriptive statistics simply using frequency distributions to look at, okay, what were the barriers like, what was participation like, what were the coping strategies, and then what was the effect. And then we looked at some use of inferential statistics, because then I wanted to go beyond just basic descriptives to determine how other things also shaped the transition experience during COVID-19. And so the use of chi-squares to see how demographics and other type of variables also affected the participation in remote learning during school closures. And I'll talk more about that. So a brief description of the survey respondents. So they were predominantly female compared to male, 66. Most of the households that we surveyed were headed by males compared to females. Most of them were employed during the pandemic, but a greater majority of them, almost 9 out of 10, worked in the informal sector of the economy. The number of children varied across the households. So again, you have about 40 that had 2 children, another quarter with 3 children, another quarter with just 1 child, and then about 12% with 3 or more children. Most of the households had children of both genders, but then you also had about a third with only male children and another quarter with only female children. Across all the 500 households, overall, we had about 1,141 school-going children in those households. The age of the parents sort of fell in 3 categories, between 26 and 35, 36 to 45. But generally, you get the picture that for the pilot, most of these parents were quote-unquote younger parents, with most of them having either a primary or a GHS education. Only about 7% had a post-secondary education. Majority of the households surveyed, their children were in public schools. Only about 12% were in private schools. And then in terms of the school burden variable that I had described, 47% had a single school burden, meaning either all their children were in primary school or JHS or SHS. But then about a third had a double school burden. So maybe a kid in primary school and another kid in JHS, or a kid in JHS and another kid in SHS. And then you had about 16% who had children across the entire educational landscape, so primary, JHS, as well as SHS. All right, so some barriers. 1, so the first observation I saw was that most households were generally ready to participate in remote learning. However, there were some households that faced significant barriers. So again, if you look at the infrastructure barrier from very high to very low, you would notice that internet access made a difference in terms of how high or how low your infrastructure barrier was. Then, the desktop, computer, laptop, or smartphone, etc., etc. But generally, you would see that most households were ready to participate in remote learning. Most households also indicated that they were aware of the various remote learning opportunities. The curious thing was that in the households that we surveyed, about 121 of them had children in SHS. And among those 121 SHS households, only 26 were aware that there was this iCampus learning management platform that they were going to use for the purpose of remote learning. There was a mixed review regarding the extent to which these opportunities were available. So the question was, if you were aware, how often was the remote learning opportunities available? And you would notice that if you look at radio, GTV learning channel, the iCampus for SHS, households had different awareness in terms of how often these remote learning opportunities were available. Participation across the different remote learning opportunities, again, it varied, but most households typically said their children participated often in either GBC radio, TV, or iCampus. The interesting thing is, if you look at all the 3 opportunities for remote learning and you aggregate it and then see the extent of participation, you would notice that it tilts more towards the very low to low participation than it tilts towards the high to very high participation. Coping with remote learning, households, so the number of questions that we asked and then in grouping them, the observation was that most of the time households were drawing on just a single strategy to cope with remote learning. So either the parents would teach the kids, or a family member would teach, or they would buy learning materials, or they would hire a private tutor for their children. If you look at the specific coping strategies, paying for extra classes was number one. But even then, you notice that the distribution is sort of very close for the top four. So about almost 30% paying for extra classes, the purchase of learning materials for children for self-study, other family members as teachers. And then the other strategies were very varied. So reading materials online, maybe they had a tablet that they would look up for educational materials, things like that. But the main thing for households, you notice that was to ensure that there was no disruption to the learning that their children were engaged in as a result of the school closures. The impact of remote learning. So I grouped the concerns of parents into three main categories: teaching and learning, finance, and social. And majority, 9 out of 10 parents indicated that their biggest concern during the school closures was teaching and learning. If you explore it even further, the concerns were about my children falling behind academically, their inability to teach their children at home, the financial cost of hiring a private teacher for their children. But again, you notice that all of the concerns were centered around how would my child be able to continue to learn and maintain their academics as we are now home and trying to do teaching and learning in a very different way, which is now remote. And again, if you look at the topmost concern, about 87% of the households were mainly concerned about, is my child or my children going to fall behind academically for all those months that schools were closed and learning was designed to be done remotely. Most parents, guardians felt that their children did not have the materials and resources needed to learn at home during the school closures. And again, it's no surprising then that majority of the parents and guardians from these households found the school closures and transition to remote learning very, very disruptive. And again, it was new. And so not even just within the case of Ghana, but if you look across the literature, you see a lot of concerns about the disruption that COVID-19 caused. Demographics did shape the experiences of parents and guardians during the transition to remote learning. So a number of key demographics that I explored in this pilot: the number of children in the house, the type of school, whether private or public, the school bedding, whether it was 1, 2, or 3, the gender composition of children in the house, and then the employment status of parents and guardians. And again, if you look at all the different dimensions of the transition experience, technical awareness, availability, participation, how they coped, coping strategies, what concerns they had, did they have the resources, how disruptive they found it. The number of children in the house only affected 2 out of these 8 dimensions of the transition experience. But you would notice that two demographic factors had the most impact: the type of school. And here, parents, or should I say households who had their children in private schools had a more positive transitional experience during the school closures than those whose children were in public schools. So for example, when it came to technical barriers, they were much higher for those in public schools than those in private schools. If you look at coping strategies, those with their children in private schools used private tutors versus those with their children in public schools drew on family members to help teach their children during the school closures. The gender composition of children in the house, the single household, whether it was males only, females only, or a mixed gender, only had an impact on the key coping strategies. But if you look at employment status, parents who were employed during the pandemic had a much better transitional experience to remote learning than parents who were unemployed. And then I explored the gender dimension even more deeply, right? So I wanted to look at particularly if the head of the household was male or female, did it make a difference in these experiences, these dimensions of the transition experience? And overall, if the household was headed by a male, the experience was more positive than if the household was headed by a female. What you would also notice is that it affected the technical barriers, the availability barriers, the level of participation, coping strategies, but not that. So for example, with the coping strategies, male-headed households, their coping strategies were more financial in nature. So they were able to hire a private tutor, or they were able to purchase learning materials for their children. The female-headed households used non-financial coping strategies. So they drew on family members, for example, to help teach their children at home. All right, and then if you look at the barriers, it also had an impact on other aspects of the transition experience, right? So the technical barriers affected development. It makes sense because if I face technical barriers, if I don't have a or internet, it makes it very difficult for me to.
Someone needs to mute their mic.
Yes. So if you face technical barriers, it only made sense that your level of participation would differ. In terms of the level of awareness, it shaped participation, but it also shaped the concerns they had. So those who were more aware did not worry too much about the impact on their kids' academics, like those who were, as compared to those who were not even aware that these opportunities for remote learning were available. And then, of course, in terms of the availability, again, if I knew that it was available, then I was more likely to participate than if I wasn't sure of whether it was available or not. And again, those who were aware that, another example I would throw out, those who were aware that these opportunities were available, although they found the transition disruptive, the magnitude was not as high as those who were not even either aware or knew that these opportunities were available. So again, the level of participation impacted three key areas, right? The coping strategies, the nature of the concerns, and how disruptive. So again, if my household participated, I didn't find the transition as disruptive as households where the level of participation was very low. So these are some of the initial observations from the pilot. In terms of my next steps, so as I said, this was just a pilot of 500 households from a small, a semi-urban area in the middle belt of Ghana. I want to expand the empirical observations. I've put in a grant application. Fingers crossed, I'm supposed to hear back sometime by next week to see if I'll get the funding. But the goal is to expand the study to cover the entire, a representative sample across, the entire Ghana, because then I want to explore the extent to which these experiences and some of these initial observations I'm seeing even differed as you move through the different parts of the country, right? If you look at the coastal belt, the middle belt, and you move up to the northern belt, again, what were the variations in the experiences that you would see. I also want to improve the framework. At this point, these are the key dimensions of the framework, but I keep reflecting and also asking myself that does this framework capture comprehensively everything that it needs to capture as one is trying to understand exactly how school closures during COVID-19 impacted households. So again, my next step is to continue to try and improve and further validate this conceptual framework. The data collection instrument was mainly a survey. If I get the funding, part of the idea is not just only to improve the survey instrument, but also to incorporate other methods of data collection, and this time doing some focus groups as well as interviews of the key policymakers whose goal was to design and implement the Ministry of Education COVID-19 response plan. I also want to expand the scope of the analysis. That's because primarily I didn't even look at any of our professional institutions, our public colleges of our grade. I mean, it's really huge trying to get your hands around what really happened. But for example, if you think about our colleges of education, where we are preparing teachers to train, we are training teachers to teach, right? What happened to them during COVID? How did they do it remotely? I have a friend who is a full-time nurse. And one of the things that I asked her was that, what happened to your nurses and midwifery training colleges and health training institutions? How did they do the training of nurses and midwives during COVID-19? Did they even do it at all? But I really want to get a full understanding of how COVID-19 really impacted our entire education landscape and what the lessons and implications are for us as we move forward. The policy implications we are talking about here is, how do we keep learning? How do we keep teaching? And how do we keep working? God forbid if there is another large-scale disruption. But even if there is not another large-scale disruption, I think what COVID has taught us is that, are there other ways in which we can ensure teaching and learning outside of the traditional methods that we've always been used to? So again, this was a very quick overview of the study. And again, I'll take your questions, your comments, your suggestions, and let me turn it back to Derek so that he can take it from there. I think I have to make him the host. So bear with me for just a second.
Oh, all right. So
Derek, I'm trying to find you so I give you back hosting rights.
Okay, so I guess the host now.
Yes.
So we have about 20 more minutes till Prof leaves us to join the meeting. And so if you have any question, maybe use the raise hands option. I'm going to, okay, so I see 4 people with their hands raised. I very much thank you also for the presentation, Prof. Osei.
You're welcome.
So I'm going to start with Basit Issa.
Yes, I think it was an interesting presentation, and I liked the idea of school burden. But I don't know if I missed something, Prof. I'm just thinking that the number of children may have something to do with the school burden if you consider the age of parents within the household. So if you look at younger household, I mean, parents who form a household, if they are young, you should expect that all their kids will be at maybe the lower level of the educational ladder. And if you have an older parent like my father, then you may have kids spread across the different levels of the educational ladder. So I think that in the next step, this could be something that you should want to pay attention to.
Okay, thank you.
Okay. I think let's take 2 or 3 at a time, then Prof can give us answers so that we can finish up on time. So Mutala Abdul Hakim.
Yes, so thank you very much. And thank you, Prof, for the presentation as well. It was quite revealing and straight to the point. Yeah, so I want to know, once we said that there were this transition to the online or whatever, definitely some people were left out. I don't know whether there were any kind of measures that could, alternative measure that could use to bring these people on board, or they were left to rot or something like that. Because once we are bringing in policies, there are people who would be like kind of fallouts. So I would want to know what Prof think about that. Thank you very much.
Okay, and then Michael, then Prof will take the first 3 questions and then.
Okay, Prof, I wanted to know why you made no effort to disaggregate the data in terms of people's income. It's talking about some of the possible understanding of remote learning. I was wondering how it correlated to people's educational levels of the parents. And I was also wondering in any way in which certain of the vulnerabilities that you're discussing are correlated to the parents' income.
Okay, your question wasn't very clear because your line kept going up and down. But Prof, you can answer those we heard clearly.
Yes. So on the number of children and the school bedding question, thanks for that that comment. Definitely in the fuller study, and even I can go back to the pilot study to explore the data even further, just to see what it looked like in terms of the bedding, the number of children, and then how those two combined then shaped the experience. Very good question in terms of those who couldn't make the transition. So those who really faced high, for example, high technical barriers, right? That you walk into a household and they didn't have a radio, they didn't have a TV, no smartphone, no computer, no laptop, nothing. What really happened to them? And in some of the few stories that I heard, it was more of nothing. So our children were just there and just at home. But these are just anecdotes. So in the next phase of the study, as I mentioned, in improving both the survey instrument as well as introducing interviews and focus groups, that is one of the key things that I would want to explore, which is if they faced all of these barriers and therefore could not make the transition to remote learning, what then happened to them? If they were just there, then what? Did they put them to non-academic use, maybe helping at home, engaging in domestic chores at home, things like that? But that's a very, very good point that you bring out, which we'll definitely explore in the next study. I couldn't catch Michael's question very well because he was.
Say again, please.
He was breaking up a little bit. So if he can repeat that, that would be great.
Is my signal clear now?
Yes,
Yeah, very clear.
Very clear.
Okay. What I was asking was, I didn't see any effort to disaggregate the data in terms of parents' incomes as well as educational backgrounds. Some of the factors they indicated, for example, people with more understanding of remote learning seems to be correlated to people with better educational backgrounds. They have more knowledge and understanding of how technology works, for example. And there's no way in which you draw these facets out. And also I was talking about in terms of income in relation to a lot of the factors that you discussed in terms of educational bedding and data and all these kind of things. And I think if you don't discuss these things, you obfuscate a bit of the discussion in terms of inequality and how it affects education as well, via the lens of the issues discussed in your research.
Thank you for that. So income tends to be a very tricky piece of information to try and collect in Ghana. People are very hesitant to disclose their income. But if you look at one of the slides, a proxy measure that I had was whether the parents in the household were employed. or not employed during the pandemic. And between those two types of households, you would see that those who were employed had a more positive, quote unquote, a more positive experience than those who were not employed around things like their coping strategy. So those who were employed, for example, could afford the private tutor, could afford the purchase of teaching and learning materials, versus those who were unemployed had to draw on non-financial methods. So if they had a family member willing to help teach their children at home, that is what they relied upon. So that gets in an indirect way also to your question of how inequalities or equity issues then shapes the experiences. And I can even think then of, if you expand the study to cover the entire landscape of the country and you get a good representative sample, how would that income dimension even play out in matters of equity and equality? So definitely for now, it was the employment status that I used as a proxy measure to gauge their financial capacity during the transition to remote learning. But thanks for mentioning income, because then in the follow-up study, definitely I'll find a way to get a sense of the extent of their financial resources, even if it is not just that of the household, but if they could even draw on the good graces of extended family members to put together financial resources. How did that change or reshape their experience? I have the educational background of the households, so definitely in further analysis, I can look at the parents' education and how that played into the transition to remote learning. But I'm really grateful, particularly for raising the question of inequality and equity as well.
Yeah, so Dennis, if you are ready with a question.
Thank you very much, Prof. That was a very comprehensive analysis. So I just wanted to maybe draw your attention to three main factors. So in your presentation, I think the findings suggest that parents who have children in private schools didn't really face a lot of challenges. So if we could even disaggregate the nature of private schools so that we're able to understand that parents whose children are in low fee paying private schools maybe face harder difficulties, or vice versa. Then again, because you look at the very high fee paying private schools, we're able to roll out new technologies and afford different digital tools to support the children. And those in the low fee paying private schools, I think will have similar experiences like those in the public schools. So if we can look at that as well. Then again, in case of access, we see that other reports are pointing to the fact that girls may face a lot of reduction in learning and the ability to cope with long-term education. So in terms of giving the access to these support or strategies by government, are we able to find out that girls were able to have higher access to these technology tools than boys? So the gendered differences, if we can do that, then it tells us that in terms of pandemic, if the girls couldn't afford some of these strategies, then we should have some alternative measures to help them, looking at the gender inequality in terms of access to education. Then again, if in the broader study, we can do more of community characteristics and the effect on the barriers you experience. So we see that in communities where they have limited access to radio network, limited TV signal, and other challenges like access to energy and others could affect how well or how consistent they're able to use some of the support that are available. I think that will also help us to see if people within highly poor communities, even though they may have the access, but may not be able to consistently use them. Thank you very much, Prof.
Thank you.
Okay, I think there is one more. Mauli. Mauli, are you there?
Yes, thank you very much. Thank you very much, Prof. And thank you for the wonderful presentation. And in the conceptual framework, we have to. I was thinking through it and looking at whether the flow of the concepts in terms of the COVID and the relationships but I'll pay a lot more attention to it. But disability issues can be one of the key factors that you can put in, because I realized that some parents had children with disabilities, especially the unseen disabilities, dyslexia, dyscalculia, and all those things, and how it's really, really impacted. Because I have an experience where, it was unstable how the child was working in that regard. So that's one of the things. We did a study on STEM education in the JHS, and then we were looking at accessibility to internet, and we realized that a lot of the JHS people had a lot of access to internet, but it was mainly through smartphones, and that means that most of them have access in the house, and it's more shared internet. So it was really interesting. That study was conducted last year, so it looks like very interesting that now a lot of parents are now giving their children access to these digital tools because of the COVID. But that's just one other thing. And then the proxies. I think the formal and informal sector also serve as a proxy, kind of, especially looking at stability of income, because it's also very important. Parents may have a job, but then because of the COVID, the person lost their job, or so the informal, formal sector may serve as a proxy. But basically, I was thinking about stability of income during the period, whether it's really have an influence on that. So thank you very much for the presentation, and I really enjoyed it. Thanks.
Okay, so the third question, Dr. Wasu Abdurrahman.
Okay, Derek, thanks. Prof, thank you very much for your presentation. There's a variable that I'm looking at, given that you intend to scale this pilot study up to cover other parts of the country. And that variable is the female labor supply in the household. So what we saw, or what we've been seeing, is that with the COVID, and given that households or these children were asked to stay at home, do online studies and all that. So this basically have implications on female labor supply. So it's the women who tend to stay at home to take care of the kids. So in most cases, they have to reduce the hours of work. If they are doing 2 days or 4 days or a whole week, they have to reduce it and all that. So this is something that I think if you intend to scale this up, you might want to look at that. I mean, it has implication on even inequality, as someone talked about, and even household income in terms of stability. If we have a situation where the female is the household head, and given that he has to stay at home, she has to stay at home to take care of the kids, and the implication on household income and all that. So given that you want to scale it up, it's an interesting area that we might probably consider to include in your work.
I think I would add up to that, because the issue of the school closures, I think one of the key areas has been for childcare. When the schools closed, mothers especially had to take a lot of time off work to take care of the children. And even when the pandemic was easing up and schools are still closed, the effect is still existing. And so, Prof, if you may want to consider the implications on parental labor supply and parental income to be very, very interesting. Okay.
Yeah. So again, thank you very much. The comment about even the nature of the private school and how that results in some variation in the experience. The gender question has actually come up in the last three comments: gender access to technology, the female labor supply, the childcare issues. The disability issue, I'm very grateful that you also pointed that out, because again, special needs children had a different challenge in making that transition to teaching and learning, and special needs could cover a broad spectrum. So it would be very good. I think the gentleman used the word the community characteristics. But I think even beyond just the community characteristics, we can even explore more what the household characteristics look like beyond just gender level of education, but the income variables, the special needs dimension as well. Yeah, in fact, I did a different presentation out of this, just focusing on the gender dimension of it for a gender research institute a couple of months ago. But I'm really glad these comments and other suggestions are coming up, because it looks like this is a multi-dimensional thing that would have different components that would need to be explored even more deeply. So thanks for the comments and the suggestions.
Okay, Cecile, Eva, are you there? You can ask your question if you're around. We have just about 5 more minutes to go. Eva.
Yes. Good afternoon. I'm just going to add a little bit from the contribution of the last gentleman who talked about the female situation. Like in his submission, he mentioned about the household heads, the men and the women, and where the men were leading their homes, it was a bit, they were more cushioned. But this point that this gentleman brings out the clarity or the magnitude of the effect that this had on women. Because if somebody actually had, what do you call it, a special needs child, 100%, for example, autism, you just had to quit your job. And so if this female was the head of a home, quitting her job and now coming to take care of a special needs child at home, that was, double jeopardy. So in your research, I would like you to try to do something whenever we have such situations, female will be considered as to whether they will be given some kind of allowances, especially female who have this kind of difficulties more than the others, so that even though you are at home, because with this kind of situation, some people did not even do 2 days or 3 days out of the week. They had to quit their jobs completely because special needs children needs almost 24/7 to take care of them, especially if you go into autism. Nobody can even help you. But normally they would have sent these children to school so that they can go to work, so that they are taken care of 24/7. So I'm just buttressing that point.
Okay, thank you. And then David. David Do.
Thank you.
Your connection is very bad, David. No. Connection is very bad, David.
And thanks for. Please, can you hear me?
Yeah, it's better now.
Okay, now I can hear you, yes.
Okay. There's a question here from Eva. She's asking, or she wants to know whether the research found a striking new phenomenon other than what other than the original focus of the study. Did you find any striking new phenomena during the research?
I not necessarily. I think it's all new in terms of how everyone had to scramble to make this transition, right? That we had all become so used to the traditional ways of teaching and learning, right? The teacher wakes up, goes to school to teach, parents drop off their kids, those who have to take public transport, right? So we had all settled in a particular way of teaching and learning. And all of a sudden, I think you see also a certain resilience in human nature, right? That the situation was thrown at us and we had to find ways to to cope, to adjust, to make it do. And I think for me, that's the one thing that kept hitting me as I kept poring over the data and had an opportunity to talk to a few people, which was the resilient nature of how resilient human beings are, how we find ways to cope even under uncertainty and stressful situations. But I think that for me, the other thing that I really want to explore is conversations with the policymakers. Because if you look at the response plan, and if you look at how radio and the TV was all supposed to work out, it really had a very little teaching component, meaning children were now households were now separated from their typical teachers they knew or they were used to. And so you also ask yourself, how did that change the dynamics of learning? Because it looked like it was really a burden now on parents and guardians to ensure that learning was continuing. And I'll be very interested to also know whether the Ministry of Education, the Ghana Education Service, now that schools are back in session, are thinking beyond now we are back to, can we start thinking of continuity of teaching and learning plans? And I'll give you a quick example. My college had about 16,000 students, and we had almost about 10,000 course sections. And we had just 1 week to move all of them to remote. I remember being on the phone 2 a.m. with the provost, trying to look at what this impact, because the state also required us to give them an impact analysis. If you can't move them, what are you going to do with them? But there was a school in New York, and I don't know how they got this brilliant idea, but about maybe 5 years ago, apparently in one of the executive meetings, a dean threw out the question, well, what if someday we can't do teaching and learning the way we know it? So they actually built a continuity of teaching and learning plan under a pandemic scenario that said, okay, we can't come to campus to teach, students can't come to campus, how would we do this? So when schools around were scrambling, trying to figure out how to do this, when the pandemic started, they were just doing dry runs. And by the time the governor issued the stay-at-home order, they were just ready to go like that because they had a plan in place. They did a test run and they validated it, improved it, and they were ready to fully implement. And for me, ultimately, that is one of the things that I want to see come out of the further studies and this research, that policymakers would use this as an opportunity, not that we want another large-scale disruption, but we want to be better prepared should the unfortunate happen. And it also forces us to rethink how we deliver teaching and learning. I changed schools. I'm now at a different college. And what they are doing now is they are actually starting up a fully online college version, what they call HighFlex, because now they're saying there are other ways we can do this besides the traditional way that we've always known how to do teaching and learning.
Okay. Michael, do you have a question?
It's more of like a query than a question. I'm just interested in the implication, because you said policy implications. So coming from a policy background, I understand that as policy people, we look in terms of consequentialism and utilitarianism, because we focus on the majority, and you can't really do deontological ethics in terms of focusing on what one must do in a particular context that is true all the time, because consequentialism is about how we make the interest of the majority what about protects the interest of the majority. I was wondering if you find anything that may, for example, be okay in terms of like it perpetuates the majority being okay in terms of, for example, if the people that were severely affected by COVID are the minority as opposed to the majority, do you have any plans on how you're still going to discuss it in terms of making people aware that though policy-wise, policy will suggest you do nothing because the majority are always well off than the minority. So that's okay. Do you have any way of bringing that to light and amplifying the minorities?
Right. I think once with all of these comments, improving the study and expanding it, I plan to make sure that the dissemination efforts is even much wider, right? So using a forum like this, but beyond this forum, making sure that you can share it in more public settings, share it with the key policymakers, even go back into the communities who provided information for the study through the surveys, the focus groups I intend to do, to go back and even discuss the findings, the analysis with their community leaders as a way of both creating the awareness, bringing some of these issues to the forefront, but most importantly, also making sure that there's a feedback loop to the policymakers to say, these are some of the critical issues emerging from this difficult period that every society has had to deal with. I keep saying that if we end up doing things the way we've always done things, not even just in Ghana, but in any society as well, where I live and work in the US, everywhere globally, if the way we think about public problems, the way we think about delivering services, et cetera, if none of that changes, then probably we didn't learn anything from the pandemic. And so my goal and my hope is that as we all engage in different types of research around different issues centered on how COVID affected all of us, that hopefully we would generate ideas and share, and hopefully we won't be the same in terms of how we think and do the things that we are interested in doing, because COVID has really forced us into a paradigm shift to think differently about a whole lot of things. So thank you for that. I'm really grateful for these comments, these questions. I'm truly grateful. I really look forward and crossing my fingers that I get the funding to expand this thing, because it's very critical that we are able to document as much as possible everything that happened.
Thank you also very much for sharing your time and your research with us. We know it came at a very, we had little time to do it, and so some of the questions cannot be asked, but I think you can always get in touch with Prof with your questions, and he'll be glad to respond to them. So thank you very much, Prof. We're very, very grateful to have you.
Yes, thank you all very much as well. Thanks a lot.
Yep, so that'll be the end of today's presentation, today's seminar. We'll be having our next seminar on the 17th of March, and that will be a presentation on human health risk via soil injection of potential toxic elements in mining sites and their options for remediation. So we're going to Galamsey site to see how the Galamsey affects our health. So hope to see you on the 17th. We will share the notice and Zoom link as the time approaches. Thank you very much. Thank you for coming. We're most grateful to have you all. Thank you.
Thank you.
Yeah. Amaoli.
Yes, Derek.
You work in disability. Are you a teacher? You work in the disability area?
My wife is into disability. She's into autism and
she's into autism.
Autism, okay. And then other related disabilities.
Are you on the platform? Are you on the WhatsApp platform?
Please. Yes, I'm on.
Text me privately.
Is that?
Can you text me privately?
Definitely, I'll do that.
Yeah, yeah. I also work on disabilities, and I'm interested in things like cerebral palsy and autism and stuff like that. Currently, I work in the Nordic countries, but I want to also look at what can be done in Ghana in terms of the what do you call it, the consequences of these early child disabilities. So it would be good to have someone with local knowledge in designing something.
Definitely. Should be prepared. Should be glad to meet up with you and then talk.
That'd be great. That'd be great.
All right. So I'll hire you there.
Sure. Okay.
Yeah. Hello, Derek.
Yeah.
This is Prince. I
wanted Prince to find out. Sorry.
Okay. Yes, sir. Okay, so I want to find out